Mental health is something every one of us has, just like physical health. Sometimes our minds work smoothly, and sometimes they don't. Mental disorders are not signs of weakness, laziness, or bad character. They are real medical conditions involving changes in the way the brain functions, how people think, feel, and behave. They affect hundreds of millions of people around the world and can happen to anyone, regardless of age, intelligence, or background. In this video, we'll take a look at some of the most common mental health disorders, explain what they are, and discuss how they affect the lives of those who have them. Let's begin with anxiety disorders. Anxiety is a normal human emotion that helps protect us from danger. But in anxiety disorders, that alarm system becomes overly sensitive. People may experience constant fear, excessive worrying, racing thoughts, muscle tension, rapid heartbeat, or difficulty concentrating, even when there is little or no real threat. Anxiety disorders are among the most common mental health conditions worldwide. One important type is generalized anxiety disorder. Instead of worrying about one specific event, people with generalized anxiety disorder worry excessively about many aspects of everyday life, including work, health, finances, or family. The worrying is difficult to control and often lasts for months or years, making daily life exhausting. Another anxiety disorder is panic disorder. Here, people experience sudden panic attacks, intense episodes of fear that peak within minutes. During a panic attack, someone may feel chest pain, dizziness, shortness of breath, trembling, or even believe they are having a heart attack or dying. Although frightening, panic attacks themselves are not physically dangerous. Social anxiety disorder involves an intense fear of being judged, embarrassed, or rejected in social situations. Everyday activities like speaking in meetings, eating in public, or meeting new people can become overwhelming. This often leads people to avoid social situations, which can affect relationships, education, and careers. Specific phobias are intense fears focused on particular objects or situations, such as heights, spiders, flying, blood, or enclosed spaces. People recognize that their fear may be excessive, but the emotional reaction is so powerful that they often avoid the feared situation entirely. Now let's talk about obsessive-compulsive disorder, often called OCD. Many people casually say they're a little OCD because they like things organized, but true OCD is much more serious. It involves obsessions, which are intrusive and unwanted thoughts, images, or urges, and compulsions, which are repetitive behaviors or mental rituals performed to reduce anxiety. Someone might wash their hands dozens of times a day, repeatedly check locks, or count objects in specific ways. These behaviors temporarily reduce anxiety, but often reinforce the disorder over time. Body dysmorphic disorder is closely related to obsessive thinking. People become intensely preoccupied with perceived flaws in their appearance, flaws that are either very minor or not noticeable to others. They may spend hours checking mirrors, comparing themselves with others, seeking cosmetic procedures, or avoiding social situations due to shame. Hoarding disorder involves persistent difficulty discarding possessions, regardless of their actual value. People often feel strong emotional attachments to objects or fear they may need them someday. Over time, homes can become dangerously cluttered, interfering with daily living and creating safety risks. Now let's move to mood disorders. Major depressive disorder is much more than simply feeling sad. Depression involves persistent low mood, loss of interest or pleasure in activities, fatigue, sleep disruptions, changes in appetite, feelings of worthlessness, difficulty concentrating, and sometimes thoughts of death or suicide. Depression affects how people think, feel, and function, often making even simple daily tasks feel overwhelming. Bipolar disorder involves alternating periods of depression and episodes of mania or hypomania. During mania, people may feel unusually energetic, euphoric, confident, or irritable. They may sleep very little, speak rapidly, make impulsive decisions, spend excessive amounts of money, or engage in risky behaviors. These episodes can significantly disrupt relationships, work, and daily functioning. Now let's discuss disorders that begin early in development. Attention Deficit Hyperactivity Disorder, or ADHD, affects attention, impulse control, and activity levels. People with ADHD may struggle to stay focused, organize tasks, remember appointments, or sit still. Some primarily experience inattention, others mainly hyperactivity and impulsivity, while many experience both. ADHD affects both children and adults and is not simply a matter of being lazy or undisciplined. Autism spectrum disorder is a neurodevelopmental condition involving differences in communication, social interaction, sensory processing, and patterns of behavior. Autism exists on a spectrum because every autistic person is different. Some individuals require significant daily support, while others live independently and have highly successful careers. Many autistic people also have exceptional strengths, including attention to detail, deep expertise in specific interests, creativity, or remarkable memory. Now let's look at eating disorders. Eating disorders are serious mental illnesses involving unhealthy relationships with food, eating behaviors, and body image. Conditions such as anorexia nervosa, bulimia nervosa, and binge eating disorder can have severe physical and psychological consequences. These disorders are not simply about food or appearance. They often involve emotional distress, perfectionism, anxiety, or difficulties coping with life. Personality disorders involve long-lasting patterns of thinking, feeling, and behaving that differ significantly from cultural expectations and create ongoing difficulties in relationships, work, and everyday life. Borderline personality disorder is characterized by intense emotional instability, fear of abandonment, rapidly changing relationships, impulsive behavior, and an unstable sense of identity. Emotional reactions can be extremely intense, making everyday challenges feel overwhelming. Narcissistic personality disorder involves an inflated sense of self-importance, a strong need for admiration, and difficulty empathizing with others. Behind this outward confidence, however, many individuals experience fragile self-esteem and are highly sensitive to criticism. Avoidant personality disorder is very different. People deeply want close relationships, but fear rejection so intensely that they often avoid social situations altogether. Their fear of criticism can lead to loneliness, despite a strong desire for connection. Now let's discuss trauma-related disorders. Post-traumatic stress disorder, or PTSD, can develop after experiencing or witnessing a traumatic event, such as war, assault, serious accidents, or natural disasters. People may experience intrusive memories, nightmares, flashbacks, emotional numbness, heightened alertness, and avoidance of reminders associated with the trauma. PTSD is not simply about remembering a bad event. The brain continues reacting as though the danger is still present. Let's move to dissociative disorders. Dissociative identity disorder is one of the rarest and most misunderstood mental disorders. It is usually associated with severe, prolonged childhood trauma. People experience disruptions in identity, memory, and consciousness that may involve distinct identity states. Contrary to many movie portrayals, people with this disorder are far more likely to be vulnerable than dangerous. Now let's discuss psychotic disorders. Schizophrenia is a chronic brain disorder affecting how people interpret reality. Symptoms may include hallucinations, such as hearing voices, delusions, which are strongly held false beliefs, disorganized thinking, reduced emotional expression, and difficulties with motivation and social functioning. Despite common misconceptions, schizophrenia does not mean having multiple personalities. With appropriate treatment, many people with schizophrenia can lead meaningful and productive lives. Finally, let's talk about substance use disorder. Substance use disorder involves the compulsive use of alcohol or drugs despite harmful consequences. Addiction changes brain circuits involved in reward, motivation, learning, and self-control. People may develop tolerance, experience withdrawal symptoms, struggle to stop using substances, and continue despite serious effects on their health. Relationships or careers. Addiction is a medical condition, not simply a failure of willpower. It's important to remember that mental disorders often overlap. Someone may experience depression alongside anxiety, PTSD together with substance use disorder, or ADHD with anxiety. Mental health is complex, and every person's experience is unique. Fortunately, effective treatments exist for many mental disorders. Depending on the condition, treatment may include psychotherapy, medication, lifestyle changes, social support, or a combination of these approaches. Early diagnosis and appropriate care often lead to significantly better outcomes. Perhaps the most important message is this: mental illness is not a personal failure. It is part of human health. Understanding these conditions helps reduce stigma, encourages compassion, and makes it more likely that people will seek the help they need. The more we learn about mental health, the better equipped we are to support ourselves, our families, and our communities. Knowledge doesn't just change minds, it can change lives.